talk to somebody about getting medication for heartburn.
Okay, well we can help you with that. My name is Meghan Smith and I am a student pharmacist.
My name is Alejandra Baez and I'm also a student pharmacist.
So we can help you with that. Would you be interested in a quick counseling session so we can obtain more information? It shouldn't take more than about 10 minutes. That way we can gather as much information as possible and optimize your self-care.
Totally fine.
Awesome. Okay. Who is experiencing these symptoms?
I am.
You are? Okay, sounds good. Would you mind coming with us in a private counseling room over there? That way we can minimize all distractions.
Sure.
Awesome. So can you tell us what symptoms you're experiencing?
Like a pain in my chest, and then I'm like bloated right after I eat food.
Okay. What are the symptoms like?
It's a burning feeling in my chest, and then like during a workout, I'll feel really bloated after I eat.
Okay. When do you eat meals during the day?
Regular breakfast, lunch, dinner, and then I'll eat like right before bed sometimes.
Okay. Have you had these symptoms in the past? Have you taken any medications to treat this in the past?
No.
No? Okay. When did these symptoms start?
About a month ago.
And how often are they?
Twice a week.
Twice a week. And where are they located?
Like lower abdomen.
Okay. Are they located anywhere else? No. So what makes these symptoms worse?
Probably like eating spicy foods makes it really bad, and then eating right before I go to bed makes it worse, and like I said, like working out, that makes it really bad.
Okay. And is there anything that makes these symptoms better or go away?
Eating, like kind of spacing out my meals. Mm-hmm. So right before I go to bed, I won't eat anymore, but then when I work out, I won't eat right before I work out. I'll space it out by about an hour.
Okay. Do you take any prescription or over-the-counter medications? And if you do, what do you take?
I take like duloxetine and then vitamin D over the counter.
Okay. What allergies do you have?
I have no allergies.
And do you have any chronic health conditions?
I have like osteoarthritis in my back.
Okay.
Lower back.
So what is your social history? Do you have any alcohol or drug use?
No drug use. I'll go out every once in a while on the weekends, trying with my friend.
Awesome. All right, well, thank you for all of this information. Based on the information you've given us, you are not excluded from self-care, and we will be able to provide you with an over-the-counter recommendation. Please give me and Alejandra a few minutes to discuss your options together, and we will come back to you shortly with an answer.
Would like to recommend you an over-the-counter medication that is called Omeprazole, and the brand name is PHAR527. This medication is normally used to untreated heartburn. Being that you have symptoms twice a week, it is considered a frequent symptoms. This medication is a dosage of 20 milligrams and is a delayed release, and it will be a tablet. So you need to take this medication by mouth with water before eating during 14 days. Don't take it after a meal because you can upset your stomach. The normal side effect that you can present with this medication is headache, upset stomach, gas, and abdominal pain. The more common adverse event, but it's rare, is like inflammation of the colon caused by bacteria, increase the risk of hip, spine, and wrist fracture, and increase the risk of renal failure. After continuing this medication, you can experience the same symptoms or other symptoms like acid reflux. Those are the warnings and precautions of this medication. So if you have any experience of this medication, you need to make sure that you contact your primary care physician. It is very important you need to avoid any interaction with the medication, like increase or decrease the absorption of this medication, like drugs or cyclophosphamide, clopidogrel, or methotrexate. If you miss a dose, you need to take this dose as soon as possible. If it is close to the next dose, you can skip it and then continue with the treatment. It is very important that you store this medication at room temperature. Don't leave it in the bathroom because you need to protect this medication of any mixtures. So I know that I overwhelmed you with a lot of information, so I want to make sure if I miss something, so can you tell me Some important points that you remember about this counseling?
Well, that was a lot. I think mainly the important ones was the 20 milligrams once a day for 14 days before I eat, and then not after, obviously. Then you said gas, upset stomach, headache, and abdominal pain was the side effects.
Yeah. What other questions do you have?
I think I'm good. Questions?
Okay. So there are some techniques we can provide to you for self-monitoring. So we recommend that you get a notebook and write down your symptoms each day to ensure they're not worsening. And if you are unsure about your symptoms, you can always come back to the pharmacy and talk to us here. We are more than happy to help. Also, that notebook will make sure that you're keeping track of if they get worse or better or anything like that. And to make sure you remember to take each dose in the morning, you can set a reminder on your phone for when you wake up. That way it will be really hard for you to miss a dose. Also, make sure do not eat a meal within 3 hours of going to bed, and try not to eat within an hour of exercise. I know it's difficult with your workout schedule and everything, but if you could, try to avoid eating an hour before workouts. That gives your body plenty of time to digest before participating in any physical activity, and also before lying down to go to bed. We would like to follow up with you within 2 weeks, or in 2 weeks. If treatment is not helping and there is no improvement, we recommend that you speak with your primary care physician. Do you have any questions before we conclude this counseling session? Awesome. Well, thank you for listening. I hope this medication will help your heartburn. If you have any questions that you think of after you leave, feel free to come back to the pharmacy or contact us over the phone.
Thank you very much.
Of course.